Hello, this is Dr. Bergum with Regenexx Des Moines, and thank you for coming to our webinar today. Today, I'm going to be talking about how to optimize your orthobiologic treatment. Orthobiologics refers to using your own cells to treat orthopedic conditions, and I'm going to go over some of the many things we talk about in the office with our patients and ways that we can help you to get the most out of your treatment to help improve the healing environment in your body. Also, in the meeting today is Danielle Lara. She's one of our schedulers. And if you have questions about scheduling or are interested in getting on the schedule for an evaluation, you can chat with her online and she can give you more information about scheduling an evaluation. So I'm a non-surgical orthopedic physician trained in sports medicine as well as board certified in diagnostic musculoskeletal ultrasound. And I am the physician at the Regenexx Des Moines Clinic. And Regenexx is where orthopedic stem cell procedures were truly invented. The Regenexx initial flagship clinic in Colorado was the first clinics in America to use bone marrow stem cells for orthopedic conditions over 21 years ago. And so just at the top, I'd like to talk about what is interventional orthobiologics. Well, interventional means we use very high resolution guidance techniques such as fluoroscopy or ultrasound to guide injections of your own biologic tissues, platelets from your blood or bone marrow extract, which includes MSCs, mesenchymal stem cells, as well as numerous other healing cells that we extract from your bone marrow to facilitate healing of bone, tendon, ligament, cartilage, muscle, connective tissue, all through minimally invasive procedures through the skin. And just kind of an overview, interventional orthobiologics is different from just your average clinician doing a unguided, palpation-guided, simple injection into a joint, which is about 95% of the procedures that are done. But interventional orthobiologics represents about 1% of the US physicians. And when I do a procedure, I'm not just, let's say you have shoulder arthritis. I wouldn't just put a simple injection in the joint because generally you're going to have numerous other connective tissue structures that are breaking down, such as the labrum or the different ligaments or rotator cuff tendons. So with all of the different joints, a given procedure may involve numerous guided injections into the various support structures. And so that takes a lot more additional training and knowledge, and that is what interventional orthobiologics is. So our goal is to stimulate your own innate healing to heal injuries or to slow down or stop or maybe even reverse the progression of arthritis. That's what our treatments are doing. We're relying on your own innate healing. And so what things that I'm always looking at what are additional avenues, additional treatments, additional aspects to your treatment that we can employ to make your treatment even more effective. And the things that I'm going to talk about today are relevant whether you have a procedure done or not. If you've got just some aches and pains or just the way you live your life, improving your healing environment in your body will help with your quality of life, longevity, pain levels. And so these apply to everyone. But if you're having a procedure, getting some of these lifestyle changes underway in advance and continuing hopefully for the rest of your life afterwards will make your outcomes much better. So if you've ever talked to like a builder, they'll say, you know, when you build a house, you want to use good wood. You don't want to use soft wood. So what I'm looking at is how can I help you improve your own healing environment in your body so that you get the best outcome. So that might involve dietary changes, use of different supplements, changes in your lifestyle. Definitely, we talk about physical activity and stress reduction, and I always talk a lot with my patients about how can we increase the blood flow to the tissues that we're treating, because we want your own cells, we want your own blood cells to get into the joint or the tendon or ligament, and there are ways that you can do to improve that. And then how can we help your healing environment after the procedure to help with the longevity of the procedure itself, as well as your overall life longevity? So the number one thing, looking at it from a big 3,000-foot view, is one of the biggest things that you can do to help your body's healing environment is to avoid ultra-processed foods as much as you possibly can. Those are the pictures here show examples of ultra-processed foods. Could be ketchup. Ketchup is an ultra-processed food. If you look at the ingredients list, it's got lots of things other than tomatoes in it. And the big offender is high fructose corn syrup. Now, I live in Iowa. It's a big corn state. A lot of that corn goes to make things like high fructose corn syrup, which is extremely, extremely inflammatory to our body. I'll talk about that more later. But that high fructose corn syrup is one of the ingredients in a lot of ultra processed foods that you see in soda pop. Lots of foods, if you look, you'll see that to sweeten things up. But there are other things. A lot of the preservatives, a lot of the artificial colors, and the ultra processing of these foods, and particularly fast foods, have bad effects on our body. And we're learning more and more just about how bad they are. And so, like, my focus, is always on how can I help your procedure? How can I help your joint be more effective? But following these guidelines will help just your overall health, help avoid you from having a stroke or coronary artery disease, or help mitigate dementia, help improve brain function. These ultra processed foods have bad effects on all of these. So what we're basically talking about is trying to get you into an anti-inflammatory diet. These ultra-processed foods are cause us to have what's called a pro-inflammatory diet. So these foods contribute to more inflammation in your body, increases your risk for coronary artery disease or cardiovascular disease, increases your risk for diabetes, dementia. I mentioned that before, but I mentioned off the top, the big offender is high fructose corn syrup. So what that does, why is that used? Well, one, it is a very strong sugar, so they can use much less of that than, let's say, just cane sugar. And the problem is high fructose corn syrup causes a very high spike in your blood sugar. What that does is it results in increased insulin resistance. That's what happens when people get diabetes. It also results in increased fat deposits in your liver. So people may have said, "Oh, they said I've got fatty liver disease." Well, that results in increased, very low density lipoprotein, the cholesterol that causes blockages in your arteries, and high triglycerides, which are the free-flowing fats that can be damaging. When you get insulin resistance, it leads to diabetes. Those high ultra-processed foods and the high fructose corn syrup is toxic to our healthy gut bacteria, or the microbiome in our bacteria. And we are learning more and more and more about how important our gut biome is to our overall health and our metabolism. Other things that the high fructose corn syrup does is it increases your appetite. It makes you want to eat more. Drinking soda pop, you end up eating more. It increases the deposit of fat around your organs deep inside your body, called visceral fat. And that's been well studied to be shown as the higher the visceral fat you have, the higher risk of death you have from things like coronary artery disease. The high fructose corn syrup causes what's called an ATP crash. ATP is a short abbreviation for adenosine triphosphate. That's basic. Think of that as the currency, the coins, the money that our cells use to trade off in the chemical reactions to generate energy. So when the high fructose corn syrup is metabolized, that fructose causes an increase in uric acid in our body. High uric acid causes gout attacks. The high uric acid decreases what's called nitric oxide in our body. So we need nitric oxide in our body. What it does is it opens up your blood vessels. It opens up, vasodilates you so you get more blood flow. It also is higher nitric oxide is involved in muscle contraction and muscle strength. And so when you have decreased nitric oxide production, our vessels don't relax and you get hypertension, you get higher blood pressure. All from one product, high fructose corn syrup, which in my opinion, it should be banned. There's other sweeteners that work well. There's natural sweeteners. A question came up, what about using honey or agave syrup as a sweetener? That's much healthier. You obviously want to use it in small amounts, but agave and honey are more natural sugars that are processed by your body easier. So we see this high fructose corn syrup in sweetened sodas, juices, candies, all kinds of sweetened processes, sweetened foods. Other ultra processed foods that I'm talking about are like chips, a lot of breakfast cereals, ready to make ready to eat foods that you just microwave, processed meats, fried foods, fast foods. And so what's an anti-inflammatory diet? Well, that's when you eat closer to the ground. If you grow your own garden and harvest things from your garden, or if you go to the farmer's market and buy vegetables and cook it yourself. Diet that emphasizes nutrient-dense foods prepared in a healthy way. There are some things that are going to be somewhat processed. Milk is processed, cheese is processed. But what we're trying to look at is the ultra-processed foods. And a good diet that I recommend, and many people around the world recommend, is following the Mediterranean style diet. That has a large focus on fruits, berries, vegetables, healthy oils like from avocado oil, ultra virgin olive oil, nuts, and the meats tend to focus more on fish. And most fish have a high content of omega-3 acids, which are anti-inflammatory. They help your heart, they help your brain, they help your joints. And so an anti-inflammatory diet is one that avoids these ultra-processed foods and is more home cooking. Another thing that helps with inflammation is called intermittent fasting or time-restricted eating. You may have heard of that. That's where you take maybe 2 to 4 days out of the week where you spend 16 hours out of 24 not eating. And one method of doing that is to have a regular lunch and a regular dinner and then not eat anything after, let's say, 6 or 7 o'clock at night. And then when breakfast comes around in the morning, just have clear liquids. You could have tea, you could have coffee or water, and then try to get to where you're going 16 hours without eating and then have a regular meal. So that time-restricted eating or intermittent fasting has numerous benefits. It can help lower your cholesterol, lower your blood sugars, help fight diabetes and heart disease, help decrease your weight, but it also stimulates stem cell activity in your body when you go through brief fasts. So again, what are some of the ultra processed foods? More pictures of what things you've seen. The thing is, why do they do this? Why do they make ultra processed foods in general? Our food industry has many reasons. One, I think they started as a way to extend the shelf life with all the additives and preservatives. The big thing is to make it taste better. Our brain craves sweets and fat. It goes back eons to as we evolved, as a species, as we evolved, getting food and getting enough calories was like the prime driving force to staying alive. So sugar gives you an immediate burst of energy, but fats caloric dense. There's lots of calories and fats, and so we've evolved to kind of crave those. Now that few people do heavy labor all day long, you don't need that fatty diet or high caloric diet. But the other thing is when you make foods that have more salt and fat and sugar in them, it stimulates the reward center in our brain to say, "Oh, this is good. It tastes good." The food companies want them to taste as good as possible, but whether it's intentional or whether it's just by accident, when you do that, it stimulates your body to eat more and more. So even if you sit down and have some of let's say chips. If you sit down with an open bag, it's pretty easy to just keep eating and eating. Some people think that the food industry has done that on purpose so that you buy more product. The more product they sell, the more profitable they are. If you're going to eat something like that, take out a look on the bag. They'll say what the serving size is. It might be like 8 chips. Put that in a bowl and just eat that. That way you won't continue to eat and eat and eat. But I'll talk about it a little bit more going forward, but there are chemical mechanisms that these ultra-processed foods work against your best needs. So what are these? So if you start on in the green area, unprocessed or minimally processed foods, like fruits, vegetables, corn, steak, potatoes, milk, things that you might think about if you're to, grow a garden and then cook it. Processed, there are some ingredients that they are processed, but they're not ultra processed. Some things have to be processed just to get it to you, like olive oil or vegetable oil or even sugar or butter or salt. That's slightly processed. And then when you get into more the processed foods would be things that like bread, juices, cheese, honey. You have to do some type of processing just in order to make these available. And then the question is, what is it processed with? So you can have jelly that's made with high fructose corn syrup, or it could be made just with fruit juice. And then you have the ultra processed foods, the pizza, the Coca-Cola, the ice cream, the chips, the hot dogs, fruit drinks, sugary drinks. These are the things that really cause you problems. So just some more pictures. You got minimally or unprocessed foods, you know, vegetables, fruits, whole pasta, whole wheat pasta, whole wheat bread, oatmeal, lean proteins like chicken breast, egg whites, steak, fish, berries. So these are all the things we want you to focus on eating, and it means doing more cooking from home. Some minimally processed snacks. So I love Vicky's potato chips. They're ultra processed. I like Doritos. They're ultra processed. I love those Dots pretzels. They're ultra processed. But what I found is once you get off of them, your body gets used to not being bombarded with these super, super flavorful things, and everything tends to taste better. So my go-to snacks are organic Triscuits. It's got 3 ingredients. You look on it, it's got whole wheat, salt, and oil. And I'm Scandinavian background, so as a kid I grew up eating Thin Crisp, and now I buy it wherever I can find it. So it's a big wafer, dense rye crisp that has 4 ingredients. It's got whole grain rye, yeast, water, and salt. So to add flavor, I'll put hummus on it, or maybe a little bit of thin slice of like aged cheese, like blue cheese or sharp cheddar cheese, or I just eat it plain. So why? I think it's been pretty obvious so far about why I don't want you to eat these ultra processed foods. But this is a list of what happens. It increased CAD is coronary artery disease, and atherosclerosis is blockages of the arteries. So you get increased insulin resistance or diabetes. It causes more food craving and food addiction, and thus you take more calories in. The Ultra-processed foods stimulate more fat storage, more inflammation, more impulsive eating. They decrease mitochondrial activity. So mitochondria are the parts of your cells that generate your power in your cells. They're very, very damaging to your healthy gut microbiome bacteria. You lose your satiety or feeling of fullness, and because they damage your healthy gut bacteria, the more pro-inflammatory gut bacteria species thrive. So one of the things, there's numerous things we're finding more and more about how important a healthy gut biome is. But one of the things that happens is you can get leaky gut syndrome, and what that means is the healthy bacteria in your gut help keep the mucus lining in your large intestine intact. If that starts wearing away, proteins can leak out of your gut into your body. And when proteins aren't broken down into their normal amino acids, our immune system detects those as foreign invaders, and it causes an inflammatory reaction. Other things like toxins that normally should get out of your body through your feces, they can leak out into your body. So a healthy gut biome helps prevent the leaky gut aspects. But there are numerous other things that our gut bacteria do that just help with our overall metabolism. There are microbacteria that when they're thriving in your stomach, they help stimulate GLP-1. People may have heard of that GLP-1. There are numerous products on the market that are injectable that people use for weight loss. They were designed to help control diabetes, and they found, wow, people really lose weight on these GLP-1 medicines. That's glucagon-like protein 1. What the injection does is really ultra stimulates that, and that decreases our appetite. But there are numerous healthy bacteria in our gut that will actually stimulate that slightly. When you have a healthy gut microbiome, that will result in increased production of what are called short-chain fatty acids, particularly butyrate and propionate. And those are fatty acids that will help decrease your appetite and improve your metabolism. So the ultra-processed foods really damage that. And there are ways to help get your gut biome back into shape. And what I tell patients is try to get some fermented food in your diet every day. I try to get either like a half a cup to a cup of unsweetened Greek yogurt, or 6 to 8 ounces of kefir, which is a liquid type, almost like liquid yogurt. But you can add sauerkraut, or kimchi is more of an Asian fermented cabbage type product to get more of the healthy bacteria in your gut. You also can take probiotics. You can take different pills that have numerous healthy bacteria. But the other thing I strongly encourage patients is to get nuts and berries in your diet. Pistachios, pumpkin seeds, walnuts, pecans, almonds. They have numerous healthy oils, omega-3 oils in it that are helpful for your heart and your brain and your joints. They have other helpful chemicals that can help with your metabolism. Some can help with healthy hormone production like testosterone. Pumpkin seeds can help stimulate that. There's ones like different berries that can help with things like help prevent cancer, decrease prostate symptoms. So it really just takes about enough to fill up the palm of your hand with some nuts. So I don't know if you can see this, but at my desk, I've got organic pumpkin seeds. If I'll take a little bit of those at lunch, or pistachios. So if I have a snack, I'll take a little bit of those. But berries is the other side of the equation. Any type of berry, that's why I put underlying berry, strawberry, raspberry, blackberry, blueberries. They're potent antioxidants that your gut biome thrives on. Your gut biome loves seeds, and the healthy bacteria love berries. Pomegranate is a super potent antioxidant. And cocoa, you can take little nibs of cocoa. Dark chocolate is healthy for you. It decreases inflammation in your body. So I encourage patients to incorporate some of that into your diet on a regular basis. The other thing is there's a concept of resistant starches and inulin. Inulin is a product that helps promote your healthy gut bacteria in your large intestine to thrive, but also helps with your metabolism. And inulin is found in asparagus and broccoli and chicory root. There are some supplements that include inulin in it. But resistant starches are starches are like bread and pasta and normal starches will get broken down pretty quickly and get released, turned into simple sugars that can increase your blood sugar. As a matter of fact, if you just take a saltine cracker and chew it up and let it sit in your mouth, it'll start to turn sweet because we've got salivary amylase in our mouth. It breaks down simple starches into sugar. So a lot of starchy foods will cause a spike in your blood sugar. That's one reason why we tell diabetics we want you to avoid white bread because it doesn't have a lot of fiber. White bread, white rice, pasta, because they cause a boost in your blood sugar. But there are starches that make it through your upper gut and make it into your large intestine without getting digested. And then when they get broken down, there's not a big spike in your blood sugar. But also these resistant starches feed your healthy bacteria in your gut. So some of the main ones are the different beans, chickpeas, beans, peas, lentils, and hummus is usually made from a mixture of those. But green bananas, so bananas, when they're ripe, they have a lot of sugar in them. They'll cause a spike in your blood sugar. But if they're yellowish and greenish or green, if you eat those, you get the nutritional benefit from it, but you don't get the spike in blood sugar. So, but there's an interesting thing that you can do if you take rice or pasta or even bread and freeze it and then let it warm up. You can convert some of those starches that cause a high spike in your blood sugar into resistant starches. So they'll make it through your upper intestines and into your colon without causing that spike. And then whole grains like wheat, oats, rye. So if you make oatmeal and when it as you cook it and it breaks down, it actually becomes more of a faster acting, faster absorbing starch. But if you make oatmeal the night before and let it cool in the refrigerator and then slightly warm it up, it'll be a resistant starch. So I do the same thing with rice and pasta. I try to cook it a day or two in advance and then warm it up. So other things with your gut biome. So plastic, we encourage people to drink water, but unfortunately, we're finding all of these plastic products on the market, plastic bottles, bottled water. When you drink from them, microscopic parts of plastic get absorbed by your body, and that's damaging over time. It can accumulate in your organs and cause damage slowly over time to your organs, but those microplastics kill off your healthy bacteria in your gut. So trying to, if you're getting water, you use a metal container or to try to avoid buying a plastic bottled water. But so there are numerous prebiotics and probiotic supplements that can help restore the healthy bacteria in your gut. And there are some that have been very, very intensely studied that will show that they can increase your GLP-1 activity. One in particular, Akkermansia muciniphila. So if you're Latin, that means it loves mucin. Akkermansia really can help prevent leaky gut. It's interesting. It thrives on the mucus in your intestinal lining. When the bacteria eats the mucus, it stimulates your cells to make more mucus and better mucus. So it's a symbiotic situation where they're eating your kind of old mucus in your gut lining and it's stimulating you to make better mucus, and that makes a better seal to prevent leaky gut. But I listed a bunch of different probiotics that you can find in different supplements. These are ones that have been very well studied to increase GLP-1 activity. One of the newer ones is this top one, Christiansella minutia. The only place I've found that is in a supplement called Gut RX. It's fairly new. There's recent studies showing how beneficial that is. But there's numerous other ones down below. Take a screenshot of that, or go to a health food store that knows that has good experience with this, and they can tell you ones that are beneficial. We have a few health food stores in the Des Moines area that I rely on for some of my own supplements and for advice. And the ones there's a it's called Campbell's Nutrition. They have two locations and they're very knowledgeable. So, so if you have questions, you can email me or talk to your local health food store. So as you can see, a large portion of what I talk about to help your outcomes is based on what you put in your body. We should think of our bodies as as an ecosystem rather than an individual person, because there are more bacteria in our gut than the total number of cells in our whole body. And there's good bacteria and there's bad bacteria. We want to make the healthful bacteria thrive. But there's numerous other things we talk about that will help your healing environment, help your body respond well. The biggest one is activity, being active, moving around, keep your body moving, doing exercise. Exercise really helps your body heal. It helps decrease your blood sugars, your blood pressure, your cholesterol, your weight. And the problem comes in where if you, let's say you have severe knee arthritis or hip arthritis, and it's hard to move around. It's hard to move your body and get the benefits of exercise. So that's one of the things that we focus on is let's get your joints moving so that you can actually exercise. But there are things you can do before your procedure. Let's say your knee is really bothering you and you have a hard time biking or running or putting weight on it. Doing exercises with your upper body will help healing in your lower body. So if you can do high intensity exercises called HIIT, high intensity interval training, that's where you're working out really hard. Let's say doing jumping jacks for 30 seconds and then burpees and then doing whole body motions where you really get your heart rate up high. High intensity interval training is like high concentrated heart benefits. You get the cardiac benefits of doing, let's say, 60 minutes of aerobic exercise. You get the similar cardiac benefits from doing a 10 to 15 or 20 minutes high intensity interval workout. But one other benefit of HIIT exercises is that can increase your platelet counts. And we use platelets in most of our regenerative medicine treatments. Even just doing gentle aerobics, walking, getting out and walking for 30 minutes a day helps improve circulation and mobility, helps improve your metabolism. So just doing some type of aerobic activity is helpful. Yoga, I strongly recommend yoga. There is different types of yoga. There's ones that are very slow movements where you're holding a position more, doing more stretches. There are some classes that are more like an aerobics class. You don't have to, the more traditional yoga called Ashtanga yoga is more of a controlled movement pattern, holding poses that you have to work on your breathing to breathe calmly through a somewhat difficult position. The benefits are you increase your strength, your joint stability, your whole body stability, your mobility, and improves your circulation. Doing yoga has been shown over and over and over again to decrease stress and cortisol levels in your body and improve body awareness. You know where your body parts are, and when you have more body awareness, you're less likely to hurt yourself. A big thing that I stress is doing strength training. Whether you've having a procedure or you're just someone in the general population, we need to be stronger. Like in a few months I'll be 60. We know that once you get into your 40s, 50s, and 60s, our muscle mass declines at about 5 to 10% per decade, somewhere more, probably closer to 8 to 10% per decade. So as we age, we start losing muscle mass. Well, you need strong muscles to move your body, to control your body, and to keep your bone density up so that you don't have fractures just from simple falls or minimal injuries. So numerous studies have shown that strength training trumps aerobic conditioning when we're looking at improving your lifestyle and your longevity, how long you're going to live. So one of the amazing things is when we when we stress our muscles, let's say you're lifting weights, those muscles release chemicals called myokines, and a big one is called irisin. That promotes local healing in your muscles, but it flows through your whole body and will stimulate healing throughout your body. There have been studies where they look at people with an ankle fracture, and they have one group do upper body strength training and the other group do none. And the fractures heal faster in patients who are doing resistance training. So those myokines go through your whole body. So the studies have shown 10 to 20% decrease in overall mortality from all causes, particularly cancer and cardiac causes in patients who are doing strength training. It improves your bone density. It increases your joint mobility because the weaker you are, the harder it is to move a joint. So oftentimes people will have difficulty with the range of motion and attribute that mainly just to stiffness and think, oh, I need to stretch more. Well, that's part of it, but your muscles need to be strong enough to move the joint through its range of motion. Strength training is shown to improve neurologic function and decrease the risk of Alzheimer's and improve your mood and definitely improves your metabolic function. So there are numerous dietary supplements that have been shown to be helpful for joint inflammation and healing. I'm not going to go all of these in detail. I'm actually making a kind of a booklet to give to patients on more detail about various supplements that we recommend. But kind of on the left column, going from the top to the bottom, I'd say the top five are kind of the biggest ones that we definitely have good data showing how beneficial it is, and the ones that I recommend the most. So the Regenexx has a high-tech research lab in Colorado where they can grow cultures of stem cells in the lab and expose them to all different dietary supplements and see do those cultures grow faster or do they grow slower? And they do the same thing with different prescription medicines. And there are a lot of prescription medicines that will actually stop stem cell culture growth or kill them in the lab. But on the left, there's those, well, let me see, the top from resveratrol down to omega-3 fish oil. Those are in the top 9 supplements that they found to stimulate stem cell activity. And Regenexx has made a liquid supplement called Stem Cell Support Formula. But resveratrol is the extract from red grape skins, turmeric or curcumin. You see that in Indian cooking. It's a bright yellow spice. Black pepper works by helping increase the absorption of different supplements, primarily turmeric and I think resveratrol. And glucosamine and chondroitin is a supplement that's been around for a long time. Those are actually some of the building blocks of cartilage and the healthy fluid in your joint, and that can be helpful for arthritis. Vitamin C is important because it's a potent anti-inflammatory and antioxidant, but you need vitamin C to build bridges in our collagens on a microscopic level for collagen growth. And omega-3 or fish oil supplements really help decrease joint inflammation, help protect your heart and your brain. Magnesium, those two particular ones have been shown to help reduce stress and help you sleep better, as well as increase brain function. Creatine monohydrate has been used for years in like athletics and weight training to increase muscle strength at a dose of 5 grams a day. There's been recent research studies of most of them were done in Germany, showing when you increase that to 10 grams a day, your muscles take up that first 5 grams, but our brain uses about 25% of all of our energy expenditure. Our brain needs a lot of energy. Creatine works in your cells by helping to make more ATP, adenosine triphosphate. When you take 10 grams a day, it stimulates that adenosine, that energy levels in your cells in your brain, and they found it can increase cognition. You can think clearer, you can think faster, think better. Patients who've been they took research subjects and sleep deprived them, made them stay up all night, and then had them do mental tasks, and they couldn't do the problems very well. But then they gave them 25 grams of creatine, and within an hour they felt like they had a full night of sleep. So taking 10 grams a day will help with muscle strength and help with your brain function. And then a lot of these other supplements are mainly for anti-inflammatory effects. Beet powder helps to increase nitric oxide, so you get more opening of your blood vessels. It also, I think, has been shown to be helpful for prostate cancer. Just eating beets in general is very helpful. And as a diversion, things like most things like carrots, beets, potatoes, kiwi, most things, if you eat the outer layer, the skin of it has most of the beneficial minerals and bioproducts in them. We always eat the sweet inner part, but getting used to eating the potato skin or the outside of the beet gives you a bigger bang for the buck. One thing I wanted to highlight on the very bottom here, I have fisetin, the dose that's done and there's a big study at Mayo looking at this. Fisetin is an extract from strawberries. It's been shown to be a potent, what we call anti-senolytic. What that means is we have cells in our body as our cells age and start dying off. Our body has mechanisms built in to kind of scavenge to eat up those cells that are dying, their normal cell death. However, we have cells in our body that they should be dead, but they're not. We call them zombie cells. And so those cells can mutate and form cancer. They can cause breakdown of tissue. And so we want those senescent, those senile cells to go away. And so fisetin taken at a dose of 20 milligrams per kilogram. So if you're 220 pounds, you'd be 100 kilograms. You take that dose 2 days in a row, once a month, and it's been shown to increase longevity and decrease cancer. So dietary supplements are part of what I recommend as to help the outcome of your procedure. Just note, a lot of these can thin your blood, so you want to talk to your physician or whoever's doing a surgery you may have or one of our procedures. And sometimes we'll say, oh, okay, if you're taking a high dose turmeric, let's have you stop that 3 days before. Or if you're taking vitamin E or omega-3 oils, they might thin your blood a little. So I mentioned there are numerous medications that, at least in the Petri dish, can have a negative effect on mesenchymal stem cells or MSCs. And we provide a list and go over your own medication list to look and see, are any of these on your list? And are there ways that we can have you go onto something else in the short term, like a month before and a month after a procedure, or maybe just switch off of them altogether? But a lot of them are some of the very common drugs like beta blockers, ACE inhibitors, ARBs, which means angiotensin receptor blockers. Those are medicines used for blood pressure, and statins, like anti-cholesterol medicines. They have been shown to have a negative effect on stem cell cultures. A lot of people take things like Prilosec or Omeprazole for heartburn or acid reflux. It's available over the counter now. They're called proton pump inhibitors. They used to be prescription only. Those also have been shown to decrease stem cell activity. Another interesting thing is it's been known for decades, if you're taking one of those medications on a regular basis, it can deplete your magnesium stores. So anyone who's taking one, they should be taking a magnesium supplement. But as it turns out, a lot of people can do fine with their GERD, gastric esophageal reflux disease, or heartburn by taking something different. Let's say Pepcid. Pepcid isn't a proton pump inhibitor, or changing the way the position when you're sleeping, getting a wedge pillow so that your head is higher than your stomach can help avoid nighttime reflux. Other things, a big thing that we talk about are things, non-steroidal anti-inflammatory drugs like Motrin, Aleve, ibuprofen, naproxen, meloxicam, diclofenac. Those are called NSAIDs. And aspirin is another NSAID. They block platelet activity. So we'll have patients stop the NSAIDs, depending on which one they're taking, anywhere from 2 to 5 days before a procedure and 2 to 6 weeks afterwards. And aspirin, you need to stop a little longer beforehand because it stops platelet activity. When I do, for instance, a platelet procedure, the platelets will release healing growth factors slowly over 10 to 14 days. And then those growth factors are taken up by cells like cartilage cells, tendon cells, ligament cells, and it stimulates them to grow. So we don't want those NSAIDs or aspirin from stopping your platelet activity. And some patients are on blood thinners, and some of them they can stop just a day or two before the procedure. There are some antibiotics that have bad effects on tendons, but most are safe. But the big ones are the floxin, like ciprofloxacin or levaquin. Those are ones that we want you to stop. Yeah. Other things, tweaks that we employ for stimulating, improving your outcomes. You need to be hydrated. Our muscles need proper hydration in order to contract. Our platelets and our cells need function poorly if you're dehydrated. So a goal is to focus on trying to get 1 ounce of water for every 2 pounds of your body weight. So if you're 100 pounds, you need to get 50 ounces of water a day. I tell patients, front load your day with the water. When you wake up, have maybe two 12-ounce glasses of water right away, and then have a water bottle, kind of like this one that I have, alongside you throughout the day, and drink water through the day. But you want to do it early. You don't want to load up on water at the end of the day and then have to get up and urinate during the night several times, and then thus not get a good night of sleep. So water is important. Rest is super important. Our bodies heal when we're sleeping. So sleep hygiene is an important part of that. And what that means is trying to get to bed at the same time every night. Stay off of your devices like your phone or tablets or computers or big screens, because the light frequency from them inhibits sleeping. So try to stay off of those devices for an hour before bed, and maybe spend time talking with your family, or reading a book can really calm you down before bedtime. Make sure the room is dark, and make sure the room is a little cooler. If the air is cool, you sleep better. Even if you have heavy blankets, if you have cool air on your head, you'll sleep better. So when you have poor quality of sleep and not enough length of time of sleep, and the length of time varies. As we age, we tend to need less and less sleep, but somewhere between 6.5 and 8 hours of sleep. Poor quality of sleep causes increased cortisol, which is a stress hormone. You get more fat storage, more muscle loss, and weight gain. So sleeping is important. Now, what do you snore or have obstructive sleep apnea? Getting that treated will improve your sleep quality and improve your outcomes from a procedure. Do you have heartburn or GERD? I mentioned getting a wedge pillow that elevates your head will help with that. Another thing we talk about is, I mentioned before, we want heat. I want you to use heat around your joint, not ice, because we want to improve blood flow into the joint. So a heating pad is very helpful both before and after a procedure, maybe 15 minutes to 20 minutes, 2 or 3 times a day. But there's recovery clothing or supports that will stimulate more blood flow into your tissues that we're treating. And there's a couple companies that I've used, Credaware and Vital Salvio. And Credaware's got the most research and has been along longer, and they have supports for all the different joints. I have a picture here of a knee support and a hip support, which actually I'm wearing the hip support right now for a muscle injury. But the way it works is it has germanium and carbon atoms embedded in the fabric. Those atoms react from your body heat to release ions and generate a far infrared field that stimulates more cellular vibration and more blood flow in your tissues. So Incredaware has done studies with college and pro athlete teams showing how they bounce back from injuries or from surgeries way faster. They've got published research showing that it increases circulation in that joint. It also helps to improve lymphatic tissue flow, so it helps decrease swelling in the area, decreases pain, and it's not a compression wrap. A compression will decrease blood flow. It's meant to be tight enough to stay in place, but not to squeeze. Patients can wear these all day. You can wear it at nighttime. If you have joint pain at night, you can wear it throughout the day. And the other company is Vital Salvio. They have similar germanium atoms in the fabric. I have a harder time finding Vital Salvio. A lot of their products are actually compression and squeeze a little too tight. Some of them don't, but we've had patients with great success using Incrediwear products. So I mentioned heat. I want you to use heat, not ice, on your affected area because ice decreases blood flow. And, if you just have an injury, if you get hit by a baseball or a rock on your head, you put ice on it, that'll help you from getting a goose egg. But like if we're talking about arthritic joints or tendon or ligament injury, heat promotes more blood flow. And so infrared heating pads are particularly more helpful because they penetrate deeper and heat the tissues deeper rather than heating the skin. So when you heat the skin, blood flow gets diverted to the surface, not down deep, and it takes longer for the heat to get down into the joint. And also, a traditional heating pad has a higher risk of you getting a burn, let's say if you fall asleep, whereas the infrared heating pads, that's not nearly the risk. And patients generally will say, yeah, that infrared heating pad feels so much better. We we have three of them at our house. So infrared heating pads are helpful. The other thing is red light therapy. There's been a lot of interest in red light therapy or red laser therapy is another term. They use wavelengths in the 650 to 900 nanogram range. And there are some very good products on the market that these products can help stimulate cellular mitochondrial activity and healing at the cellular level. Unfortunately, there are many products on the market that you can buy red light blankets or red light pads that are just really cheap design of LED strips connected to a power supply. I have been very impressed with a product called the DNA Vibe, and this one in particular is a Jazz product. So I've looked at the actual design of this. It has a custom microprocessor chip, thin film, integrated circuit design. Before I went into medicine, I used to be an electrical engineer. I used to do integrated chip design. And so I looked at their design about a year and a half ago. I was super impressed, but it's got four modes of operation. You have red light therapy with the different wavelengths for surface tissue, the 650 to 675 nanometer wavelength, and the 825 to 850 gets into the deeper tissue. It actually will stimulate harmonic oscillation of your DNA, your DNA is a double helix, a sinusoidal pattern. It will start to oscillate when you start going through a new protein synthesis, and this helps stimulate that. But it also has a slight amount of vibration that can help with pain levels and also helps to get the red light to penetrate into the cellular level. And it has pulsed electromagnetic field therapy, PEMF. That's another modality that has been shown to stimulate healing at the cellular level. It's a portable device that I have shown over here. Use it at home. We have a QR code with the Regenexx in the middle. If you scan that QR code, it will take you to a microsite with the DNA Vibe company that has we have a supply there that they can sell to you and handle your payment and your shipping and get it to you in a couple days at a discount. We have a built-in discount, but the company also has discounts around holidays. So like if you go to the website, if you look at the DNA Vibe website, they'll probably have an ad for a Memorial Day discount of like 20%. But anyway, I've personally used that for a number of my own personal injuries with great success. And I've also done a whole body red light therapy treatment. I do this kind of on a regular basis at a place called the Light Lab. And they have some of the most advanced red light beds available. This is a picture showing someone in the red light bed. It's got red light modules on the front and the back of you, so you're kind of sandwiched in between. There are different panels that they do different frequencies, like the different frequency for the skin on your face versus your body. This device monitors the energy that's going in and the energy coming back, and they have different functions that you can choose to maximize your treatment. There's one setting to maximize for skin treatment. People will use red light therapy for like wrinkles or damaged skin. There's a setting to improve your circulation. There's one that helps with pain, and there's one for muscle recovery, and there's one for fat loss. And so I have the different frequencies that they employ. And so red light therapy is something that I routinely recommend. A big thing is reducing stress, both physiologic stress and mental stress. If our bodies are stressed, we don't heal as well. Mainly because of when you're under stress on a chronic basis, our cortisol levels stay high. We need cortisol to stimulate a fight or flight response, or if you've had a sudden injury, or if you're running away from a tiger, but we don't need it on a daily basis. So stress reduction through meditation, sauna therapy, either through a traditional steam sauna where you throw water on the rocks, which I prefer because I'm half Finnish and half Norwegian, and that's the way you do it. Or the new modern ones are red light, ultraviolet. What am I thinking of? I'll think of it in a second. But they don't. They have panels that the infrared. That's what I'm thinking of. Infrared saunas that heat your tissue, your body tissue, kind of from the inside out, rather than heating the air. And there are numerous places in the Des Moines area where you can do these sauna therapy on either a weekly or a monthly basis, or a one-time basis. And a couple that we've arranged discounts with are Perspire Studio and Pause Studio. So sauna therapy helps with circulation. Doing it on a regular basis, like in the traditional Finnish sauna, has been shown to decrease risk of Alzheimer's, coronary artery disease, help with muscle recovery. So other things that help are massage, hands-on massage therapy, Tai Chi, and sensory deprivation chamber or float therapy. This is also available at pods. So this is where you go in a pod like this. You can close it. You can turn the lights off. You can leave it slightly open. But if you close it off and you're in the dark, you float in very, very, very dense salt water. So you lose sensation of your body, and you can lay in there for an hour, and it is extremely relaxing. It really helps loosen your muscles as well. If you're claustrophobic, people don't want to close it, but you can still close the clamshell, but you can still get benefits of the float therapy. Some other ancillary treatments, vibration plates. People have used that. They actually have vibration plate therapy as part of the light lab. So it's a plate that you stand on and it vibrates, and it can increase lymph circulation, help you with your balance, and there's good research showing it increases muscle strength, not as much as lifting weights, but it will increase your muscle strength if you've done on a regular basis, and it can help prevent osteoporosis. Some other treatments on the market, shockwave therapy, where they're putting shockwaves into your bones and tendons and ligaments. There are many positive studies showing that can improve your outcomes. We actually don't know how that works. We just know that it works, and there's still a lot of research going on shockwave therapy. And their hyperbaric oxygen chambers have been shown to improve tissue healing, more collagen growth in tendons and ligaments, increase blood vessel growth, and can have antibiotic activities. Those are ancillary treatments that can help improve your outcomes from our treatments that are using your own cells. So I just wanted to put up some of the community partners at Regenexx Des Moines. We've patients who come to us can get a discount at these different community partners. The Light Lab I mentioned has the red light therapy. Perspire is a sauna studio. Pause has the flotation device and compression therapy and IV vitamins and infrared saunas. PLN is Project Lean Nation. That is a kind of a store, a business that makes completely no processed food meal packages, super healthy meals that you can pick, like a higher calorie amount, around 650 milligrams for athletes, or a more of a maintenance meal, a dose of about 450 calories. And like my son is an athlete, so rather than having him eat hot lunch, we have him take one of these for lunch. Or if I don't have time to make a healthy lunch at work, I'll take one of these. They're frozen, and you microwave them. So there are other I just haven't had time to research all of the options in the Des Moines area, but I know there are other groups that will make healthy meals like this, like Project Lean Nation as well. But these are some of the local people, the local businesses that I've collaborated with to get a discount for Regenexx patients. So just to kind of wrap things up, we have the most advanced treatments to use your own cells to help your body heal. But I am always looking at how can we make it better? What are other things we can do with your diet, your exercise, ancillary treatments to make an amazing treatment be even better? So that's what I really wanted to go over today. And these are things that I talk about when you have an evaluation with me as well. So a question came up, will we be sharing a recorded version of the Zoom? Yes, everyone will get a link. I think it's a YouTube link of today's webinar. And then you'll be able to pull up those different supplements and if you want to look at some of the doses. And again, I want to let you know if you want to speak with Danielle Lara, she's one of our schedulers. She's available. You can in the messaging section, you can send her a message. She can help you if you're thinking about getting in for an evaluation. So, are there any other questions before I end our webinar today? Let me see. I don't see any other in the. Okay, let me check here. Oh, so one question, does Incrediwear have clothing for the shoulder? Yes. So if you go to their website, they have a shoulder sleeve, which I've used. They've got back supports, they've got wrist, they have fingerless gloves. So the fingers are free, but they go on your hand and wrist, which help for arthritis or carpal tunnel syndrome. They have hip, they have elbow, they have all of them. And they're helpful for the shoulder. The one downside of all of their products, the shoulder one, I have the biggest problem with in that the way it comes up your arm, up your shoulder, and across, and there's a Velcro strap that goes across your chest and to your back to hold it in place. And men tolerate that well. A lot of women tolerate it well, but a lot of women complain because it can rub on your breast. But that on their website, you'll be able to see what it looks like. Also, if you go to incrediwear.com, INCREDIWEAR, incrediwear.com. If you order anything from Incrediwear, we have a 25% discount code. When you check out, if you type in capital Z, lowercase ACH, ZACH 25, ZACH 25, you get 25% off. So yeah, Incrediwear I've been very impressed with, and unfortunately I have many Incrediwear products that I've had to use on myself. So we really don't have vitamins in the office. We do have the Regenexx stem cell support formula, which it's a 1 month supply of the 9 supplements that were found to stimulate stem cell activity the most. When patients are doing a stem cell type procedure, we give you a bottle of that and say, start taking this 2 to 4 weeks in advance. And preferably and we encourage you to buy like a 4 to 6 month supply afterwards, but we give you a bottle up front just to try to stimulate your stem cell activity in advance. But other than that, we really don't have the supplements. So can you review my medical background and history a little bit more in depth? Okay, let's see. It goes back to the 80s and 90s. I went to the University of Minnesota and got my undergraduate degree in electrical engineering. I worked for Motorola, designing cell phones and other electronics for about 6 years. I went to medical school at the Chicago College of Osteopathic Medical School. That was like 95 to 99. I went to the Mayo Clinic in Rochester for family medicine residency. After that, I went to the Ohio State for my sports medicine fellowship training. After that, I worked at Mayo Clinic in family medicine, doing family medicine and sports medicine for a few years. Then I moved to northern Minnesota and worked as a non-surgical orthopedist with the orthopedic group with the Duluth Clinic. in northern Minnesota doing all non-surgical orthopedics and ultrasound-guided injections of those terrible steroids that damage your cartilage and tendons and ligaments. I did that up in northern Minnesota for about 9 years, and then I moved back down to southern Minnesota, worked for the Mayo Clinic healthcare system in Albert Lea and Austin in the orthopedics department as well, doing non-surgical orthopedics. Throughout that period, I got board certified as a musculoskeletal ultrasound, diagnostic ultrasound. It's called RMSK. So I do diagnostic ultrasound. I use ultrasound and X-ray guided fluoroscopy for all my procedures. And for about the last 5 or 6 years, I've done completely just pure regenerative medicine through Regenexx. And yes, so that the vitamin, the Regenexx stem cell support formula, we can mail that out. It's kind of heavy, but yeah, we do often mail that. Let's see, they got some other questions. I'm having trouble getting a diagnosis of my problem, scapular pain, mild back pain. Yes, the question is, do we do a diagnostic ultrasound for that? And yes, I do a diagnostic ultrasound. Regenexx takes medical insurance. Medical insurance will pay for your office visit and your ultrasound examinations. Standard medical insurance does not cover regenerative medicine treatments. However, Regenexx has the world's largest collection of data where we track all of our outcomes, all of our procedure outcomes, and that goes back for over 20 years. Regenexx has been approaching corporations and municipalities and school districts, employers that have self-funded insurance plans, and saying, look at our data, look how well our outcomes are, how well we do, and how cheap it is compared to surgery. And as a result, there are now about 3,500 corporations that provide will cover Regenexx treatments as part of their benefit programs if they're done at a Regenexx clinic. So there are a lot of corporations like Hy-Vee, some of the, I mentioned different municipalities, Dunvargan, Musco, they do lighting. A lot of corporations that will cover Regenexx treatments as part of their medical plan. And the treatment is not covered, another question, by Medicare insurance. No, that's cash pay in those cases, unless you have, or unless you work for one of those corporations. So how can this treatment help a rotator cuff? So we treat shoulder issues all the time, shoulder arthritis, shoulder rotator cuff injuries. So it comes down to rotator cuff are the muscles that rotate your shoulder. They turn into tendons that attach on the humerus and help you to rotate and lift your arm. So our data, our outcomes data will show if you've got just mild, low-grade rotator cuff tears, platelets from your blood, platelet-rich plasma, will treat that well. If you have higher grade tears where, let's say, more than 50% of the tendon is torn, that's where we use bone marrow extract to get stem cells and other healing cells to inject into the rotator cuff. If the rotator cuff tendon is completely torn, as long as it hasn't retracted more than a centimeter away from where its attachment is, you're still considered a good candidate for the stem cell procedure. If it's torn, full thickness and full width of the tendon is torn and retracted more than a centimeter, we'll say, don't bother with this treatment. Our outcome data shows you are not a good candidate. You should go get your rotator cuff surgically repaired. Another question is, my son already had PRP. Will Regenexx be able to help this? I'm wondering, are you wondering, would more PRP help? Or would the stem cell therapy help? And generally, yes. So that brings up a good point. There are many places that will say, yeah, we do PRP. It's a different, much more thorough treatment when you come to me or other Regenexx clinics, because one, most of the other clinics that do PRP, they cannot make the PRP at a strong enough dose to be as nearly effective as we can through our custom lab processing techniques. As you get older, you need a higher number of platelets to be effective, and we customize your treatment based on your age and how much damage you have to pick the right dose or the right concentration of your PRP and the right amount. So we do a higher dose PRP in general. The other thing is other clinics, let's say you have knee arthritis. So say, oh, we can do a PRP injection, kind of like, oh, we could do a cortisone injection, or we could do a hyaluronic acid lubricant injection. They think of it as just another thing you can inject inside the joint. That injection at other clinics most often is not done with any type of guidance, so you're not really sure where it went. whereas mine are always guided. But the big difference is when I do your evaluation, I'm looking at, yeah, okay, you have arthritis, but I'm also looking at all the support structures, the ligaments, the tendons, the joint capsule. If you have instability in all those, you need to strengthen those. You need to treat those. So at Regenexx, at our clinic, you may be having your knee injected, but I might be injecting 5 or 8 different structures. And some of those structures, like the ligaments that go along the side of the knee, I might put PRP in 5 locations along those. So it's a much more thorough joint treatment. So yeah, to answer your question, yes, his son probably would benefit from a treatment with me if he's had PRP and maybe did not get as good of a result. I've seen numerous patients who've had treatments elsewhere, particularly a certain clinic that advertises thoroughly on AM radio that have not had very good results, or they've gone and they get sold a package of an extremely expensive treatment without even like examining the patient very well, who have instead come to me and gotten great results. Let's see. Does Regenexx check with a person's insurance to ensure the visit and the ultrasound diagnosis is covered prior to the visit? We we don't actually call them and get a prior authorization, just like if we do look and see if you're if I'm a physician under that insurance plan, like there may be some insurance plans that I'm out of network and our schedulers would let you know up front. But if you're in network, your insurance should cover it. We don't actually go and get prior authorization for a diagnostic ultrasound because we've never had an insurance company say, "Oh, that's not authorized." Just like we do X-rays, we have X-rays here too. So if you have a joint pain, you will get and you haven't had X-rays or an MRI done beforehand, we do X-rays too, but that's not something that we have to get prior authorization for. So lots of good questions. That's great. That helps me remember things that I may have otherwise wanted to talk about. What else? Looks like things are kind of wrapping up. Let's see. All right. Well, looks like I've gotten through all your questions. So again, if you have further questions, you can always email me. That's my contact information, telephone number, and our website. My email is rbergum at regenexxdsm.com. So that's regenexxdsm.com. But again, there's our phone number and also to our scheduling team. So thank you for your time. This went longer than I had planned, but thank you for sticking around. And again, if you have pains or areas that need to be treated, our scheduling team can get you all set up. And I hope you have a great day. Enjoy the spring, enjoy the summer, and hopefully you can take this information that I provided and make meaningful changes to your lifestyle to help your whole body, regardless of whether I see you for a treatment or not. So again, Dr. Bergum, have a great day and take care.